we are going to be discussing cybersecurity. Now, this is something that I have hosted in the past, and cybersecurity is a big deal right now. And it is so easy for any one of us to fall victim to handing out an OTP or accidentally leaking data. And I think being in the healthcare, protecting patients' data and your own data is very important. So as we switch to this topic, the next panel discussion is cybersecurity in digital health, safeguarding the patient's data and privacy. As healthcare goes more and more digital, the importance of safeguarding the data has never been more important. After all, trust is the foundation of healthcare, and breaches can undermine the trust in seconds. This panel discussion will explore how we can stay ahead of cyber threats, protect sensitive information, and build systems that patients and providers can rely on. It is a must-attend for anyone passionate about the intersection of technology and healthcare. So, part of this panel discussion, we are going to be welcoming back to the stage UC Mata and our panelists Aditya Talapragada, Professor Dr. Tobias Winkler, as well as Dr. Amal Afhadi. Please put your hands together as we welcome our moderators and panelists.
Good afternoon, everyone. Last panel discussion for the first day of the Health 2.0 conference, and we are going to talk about cybersecurity in digital health and safeguarding patient data and privacy. And I think that would be good to start from the introductions. And so I'm going to ask from the panelists to introduce yourselves and tell why you are interested about cybersecurity.
Good afternoon, everyone. I'm Aditya Talapragada from AKT Health. We are a life science and data analytics firm, and then we have been working on a lot of digital platforms focused on patient experience, improving patient care. And then obviously every aspect that we design an application or generate the data or generate evidence, every aspect has been focused on how we give that extra layer of security in the entire designing of the app. We have been working a lot on clinical research applications, medical applications as well. Slowly I'll discuss a bit more detail on how we can actually how we have been working on this area. Thank you.
So my name is Amal Hafdi, and I'm a breast and surgical oncologist. Actually, I'm a physician, so I'm a health provider. And I'm also the chair of the research of surgical department committee. And in the same time, I'm associate professor in Al Faisal University. The extra thing that you don't know about me, I'm a board member in IT Solution for Cybersecurity.
My name is Tobias Winkler. I'm a professor for regenerative orthopedics and trauma surgery at the Charité in Berlin, at the Berlin Institute of Health, in which board of directors I'm also in. I am running a lot of clinical studies with patients in the musculoskeletal sector. Of course, we are confronted with the Charité is a big hospital. It has 24,000 employees with cybersecurity, and also for our patients in the research part and also in the clinical part.
Okay, thank you for the introductions. The first question might empty the whole table, but is cybersecurity slowing down the innovation and adoption of the digital health solutions?
I think to take it, because I think people haven't been taking cybersecurity very seriously. Of course, every time you design a new application, the cybersecurity aspect of it, the security aspect of it comes extreme last thing. So I think the innovation is not stopping, but at the same time, the threats are increasing. So I think if you, once again, if you actually have to create some kind of an application with multi-factor authentication and then, things where you make it easier for the patient, then obviously you are actually making it complex to use the application. So that's where sometimes we are not able to launch applications which are not very patient friendly, considering the fact that you have to take care into different kinds of security layers that come into the application. So to some extent, yes, some kind of innovative applications are being layered because of cybersecurity, but then still I see that the aspect of cybersecurity is not being taken seriously when designing these applications.
Again, yes, my answer is to the little extension, yes, there will be some delay. And the reason behind that, not only what he said, but we will forget about the other hand. So we are innovating in our technology, but other people who want to attack us also, they have their innovation, so they keep upgrade themselves. The risk here is not because of us or because of the people who innovate the application or the technology, but we forget about the general population. So there are two parts who are familiar maybe with the technology, but the majority of us as in the middle or maybe below the average. So it takes time to let them be aware and to train them. So it's not only the application, but also you have to train the people. This takes a lot of time. By that time, a lot of attack will happen.
I think the answer is clearly yes. The question is, is it a problem? Or do we have an alternative? And I think we do not have an alternative. The alternative will be only to make it better, to make it faster, and to make it easier. And I think this is the most important thing around that. If you look into regional discrepancies between data protection laws, for example, this is, for example, an issue that we as a community could solve or could help solve. Because I'm Austrian, but I work in Germany since 20 years. Germany has one of the most restrictive data protection laws and also implementations, which is slowing down a lot, but which is also protecting a lot, of course. And looking at the research part, because this was the question, we do see that a lot of companies and also a lot of spin-offs of academia are struggling with these very, I would say, dedicated and very penal and very strict laws and the regulatory system of the GDPR there. But nevertheless, if we then have a product, it's super safe on the market. If I look at other markets, overseas, for example, where it's a bit easier to get over these hurdles, then you have a lot of products, but they still have to fix a lot of issues. So the question is, what is the better way? I have no answer to that, but I think we have to work on easing the processes for developing our products in order to protect them from over-regulation, but on the other side, not to be too low level.
Yes, I agree. What I've seen actually in the market, and not only talking about data security, but the regulation and compliance overall. For example, I've seen like Switzerland is not part of the EU, and EU legislation doesn't really bother the Swiss companies. So actually, Switzerland has changed the legislation like earlier before. In the EU, there's a new medical device regulation that sets a lot of compliance needs for the software developers as well. And the previously Swiss law only accepted solutions that are regulated or certified in EU. But after EU introduced the new MDR, they changed the regulation that you can introduce a solution in the Swiss market also if it's certified in the US, and that is to ease actually market entry for the local companies, as Switzerland is known to be a medical device hub. So that's a clear example of how regulation can slow down the innovation. What do you think is at the moment the biggest threat in a cybersecurity side?
See, if you look at most of the threats that we have seen in the market, especially if you look at the HIPAA journals and everywhere, we see still the ransomware phishing attacks are the highest. The access control has been biggest challenges. That's what we see. I think one of the other challenges we see is that most of the systems are still not having a zero trust feature. Which is also a biggest challenge, where having a continuous verification even with zero trust systems will actually improve that. But that's what I think ransomware has been the biggest, followed by phishing and then the access. These are the biggest threats that we see in general. Of course, I actually am based in Japan, where the technology, there is no cybersecurity team in any of the hospitals. Even if you look at the biggest of hospitals, you don't see a cybersecurity team. And most of these people, they don't really understand the value of the data that's sitting on their on the back end. And then usually if you go into their network, just like hospital network, you can actually access to the entire electronic health records. So obviously these get analyzed and then sold into the dark net. So I think one of the biggest challenges is still the access. The local access is the biggest challenges when you look at the Europe, and then we see zero trust, and then the phishing, ransomware are the biggest threats that we see in the market right now.
I totally agree with you, but I will add also that training of the staff, we are missing that. I'm glad that we can see now there are a bachelor degree in cybersecurity. There are a lot of courses, which is really important, but I think it should be something mandatory for organization like healthcare. Maybe being a healthcare institution attract more actually attacks comparing with other companies or institution. The other part of it, actually, I will think about the prices. Still, the prices is high. If we want to really have a good cybersecurity to prevent those attacks, the prices is really high. And I'm glad that you speak about the healthcare data. It's really huge data. So you want to store it, you want the privacy, it will cost more and more and more. So the cost is really something you have to think about it. The other thing, actually, I think the legal part of it is very important. Even if we think that we know a lot about it, but still until now we cannot really know all the thing about it. And this is another issue which we need to orient ourselves about it. This is the major thing, but because of that, this limits the healthcare provider and leaders from using a lot of stuff. And this also will prevent us from using the technology on time.
Yeah, the biggest threat, to my mind, is actually, again, working in large clinics, the dependency of our systems on IT systems. If you would have asked me 15 years ago, maybe already 10 years ago, we would still have, if the system went down, we would still have possibilities to get a patient funneled through the system with admission, with anesthesiologist examination, and with surgery, and with discharge. If now the system is down, nothing happens anymore. So we were confronted with one attack that shut down the system for only, only a little time, but the whole clinic stopped. And this is, I think, how we, or what we have to build in the healthcare system at least, alternative systems that immediately kick in and that allow us also, if it's on a lower level, to really run everything. Because we have, of course, but we have patients on ventilation, we have patients on full life support, more or less, and we have, of course, patients who lie in bed and don't need any IT. But in this spectrum, of course, we have super vulnerable patients, and we have super on processes, and we have super non-vulnerable. And for these vulnerable processes, I think, and for the whole system, we need robust systems that help us in case there is an attack to also treat these patients without any any problems at all. And this is, to my mind, the biggest threat.
Interesting, different aspects. Thank you for the comments. I actually have to add to your comments. So I remember first time when we deployed our solution in one of the university hospitals in Helsinki and in Finland, and their data privacy officers were reviewing our papers and documents, and and we were really doing the first pilot with around 10 patients, so really small scale. And at the same time, there were in the newspapers that someone in the hospital had thrown out like hundreds of papers full of medical records to the trash bin, and someone had found them outside of hospital. So talking about the data security. But what is, in your experience, the biggest incident that has happened? Biggest like a data security incident or that has happened in your career?
Actually, the thing is, we were working on implementing a new system for a hospital, but we haven't been attacked directly. But the hospital, it was already been attacked because most of the data was already stolen, and then they didn't even realize unless we went into the hospital, and then we were easily able to get in, and then we saw the access log that they have been continuously being taken away the data. That was one of the things, but obviously, just understanding, you had these legacy systems which were offline, and then these could be few challenges where legacy systems, they could be easily accessible with the wireless network. The security is less, but the access is good. But then hospitals, how we protect the legacy systems, security is also one of the things that we always usually look into. But you were right, sometimes the system goes down, the entire infrastructure goes down these days. But in the past, you had this offline storage inside because even now, most of the clients that we work, especially in Japan, they don't prefer any online systems. They want most of the data to be stored offline and then inside the hospital to make sure that they have the right access in the right time. But at the same time, when you are not automating the processes, it's very difficult to analyze the threats that are coming in, especially when there is multiple networks in the same hospital and the hospital is too big to manage that infrastructure. Obviously, if the automation processes are not in place, the third parties are not connected, and we see these kind of attacks happening on the hospitals all the time. But then it's a very complicated scenario these days because obviously everyone wants to be online. We want real-time access to the patient data, especially in most of the cases these days. You have continuous monitoring devices, continuous wearables, so everything is becoming continuous data transfer. When it's a continuum that's happening, it becomes more complicated for us to actually predict this data. And then with more and more wearables coming into the hospitals, more and more devices coming in, you can't really put that legacy systems all inside the hospital. Of course, you have to have automated threat alert systems and everything's in place. So yeah, in short, that's where we still have these incidents that are happening from small hospital perspective. But if you look at big software as a solution providers, SaaS companies, I think the threats are completely different. Usually your entire systems get hacked, and then the loss is a huge, a lot more compared to a single hospital.
I cannot recall something really huge recently, but I can recall one incident of a strange email in which they have some worm on it a few years ago. And actually, to tell you the truth, since that time, we are not accessing the email easily, so they don't accept any foreigner from outside, so we use it internally more. And they have to trust any email coming from outside, otherwise they will not deliver it, or they will not send it from our emails. Regarding the backup system, I'm glad that we have a backup system. So when the thing really shut down, we have a backup system. So in each floor or each unit, there will be at least 1 to 2 backup system and software. I guess maybe there will be some issue later on with synchronizing the data, but they still can be do it. And still until now, we are still having paperwork just in case, and we have to make sure that everything has been scanned and put back in the system. But to tell you the truth, yes, because we are afraid from attacks, so they are becoming very restricted, so we are not using even the flash. We can use any CDs. We can do anything, really, except through the IT or the people who are really know how to use it, and they can scan it before they use it. And I cannot transform any information from my own laptop or computer to the hospital or the university or the research center institution. So they become very restricted, I will say, but the number of attacks is much, much less.
Yeah, same here. We can't do anything anymore with our computers there, except for working within the system, which brought, of course, a lot of problems. But as I said, it's all about easing these processes. I think the biggest one I already told you. This was when the system went down for, I think it was 2 or 3 hours, and this was a big problem. And the attack was a very central attack, not on our servers, but on worldwide servers. You surely know that. The biggest one that I've ever experienced in my life is an old one. My parents are also doctors, and they had the first computer system. And my father had a crash, lost 25 years of data of all their patients, 10,000 patients, and the backup system was corrupted. So this was a story from the 90s, early 90s, and this, thank God, or whomever, is something that we can omit nowadays. But on the other side, to make it super secure, it's also, of course, super complicated. And we also try to scan all the documents that we have, but they're also digitally then stored, and they are not physically stored. And this also poses a problem if somebody really gets into the system, if the layers are not super protected. But I think this will be the future, to just make this processes easier. And it will be your task, probably.
I have to share one example. Luckily, not from my life, but in Finland, and only 2 years ago. Like hospitals and clinics, of course, they require all the possible regulations and evidences and audits from the providers. But there was a not even small, but like a smaller mental health clinic chain with 30,000 patient records, and they had their house-made EMR system, and the hacker had found that the username and password to this system was root, and hacker downloaded information, all the possible information from 30,000 patients, asked for the ransom and money, or he would publish them publicly in the internet, and that was, of course, a big incident. That clinic went into bankrupt. The CEO of Avu was also the founder of the company, and the developer of the internal systems is in jail. But also the hacker, he made a mistake. Or at least he says that he didn't have a purpose to actually publish the information. He only said that he will do that, but he accidentally actually published all the information as well. So it was for a couple of hours, the information was all available in the internet. And especially as it was a mental clinic, there were some celebrities, so it was a very, very, very big thing in Finland. But balancing the security and usability, how can we design secure systems without, or we cannot design secure systems without compromising the usability, but what would you take into account when designing the new systems?
Yeah, I think this is not just happening with the looking into the cybersecurity aspect as well, because when we are now designing clinical trials, we are actually taking patient consent and how better the system would be. So when we design the protocols, like bringing in patient voices for everything we do. I think everything has becoming a bit more patient-centric these days. So I think without most of the applications that we design are first being taking how the patients want to see this. Of course, we are not compromising on the security part. Because if you see Dubai has most of its data on blockchain, we also are using enterprise level blockchains. That's one way that we could easily transfer the data. At the same time, we are also very much concerned about not giving too much information on the architecture to the patients and the providers. We are just focusing on the security part completely separately so that we keep the application as simple as possible. But at the same time, we still have to include multi-layer security features and then zero trust features and all. Now, the usability part, I think people are getting used to it now compared in the past. They also understand the value of having those kind of systems in place. So it's always kind of the voices being taken from the providers, from the patients on how better how user-friendly we could design, at the same time not compromising on the security part of it.
I would say I will not compromise it, except it's a life-threatening, really. I'm a surgeon, I have an emergency cases, but otherwise I will take it seriously, because any simple mistake, it can really cost you a lot. So I will take it very serious. I will not compromise it at all, but take it short and ask an expert if you don't know, or try to build your experience and know all the policy and the procedure. But any compromisation, they mean you may do something, or you may harm yourself or somebody else.
Yeah, same here basically. Yeah, nothing more to add except for maybe that our mental health data within our clinics has an extra protection layer. So not even me can access the data from inside. You really have to, this has to go a direct and official channel, whereas of course I'm also a trauma surgeon, so I do have, I can access data from other patients because I need them in a lot of cases, but for the psychiatric diagnosis and also treatments, I can't.
We have an interesting panel, like we have people from 3 different continents, or like 2 different continents, but still you are in Japan, so it's almost its own continent there in Asia.
Scandinavia, Europe.
Yes. But what kind of authentication methods you have in use in the systems? What kind of authentication methods, like a
single sign-on,
yes,
like multi-factor
and what kind of identities you benchmark?
I think it mostly depends on the systems that you have. Usually, most of the hospitals have legacy systems where the authentications are very, very basic. But when you are implementing new systems, obviously you have multi-factor authentication, you have 2-factor authentication, you also have single sign-ons at the same time for multiple applications. But I think it's completely varied from provider to provider for our side. It's a very wide authentication system because we are basically a technology company. So we usually sometimes work with whatever we have got on the provider side. On top of it, we have to implement security policies. But most of the time, it also depends on their security policies that the companies have, and then we have to stick to their authentication methods and build something which is into their policies. So yeah, it's pretty wide in terms of what kind of authentications we use. It differs from provider to provider for us.
Yeah, I agree with you. It's almost the same. We have a restricted policy in our institution, so the password should be changed every while. And you have, I think, 3 trials to enter it correctly. If you didn't, then you have to call the IT, and you have to prove that you are the same person or not. You should use a special feature for the password, and then actually it should be complicated. You cannot use the same password if you use it before for the last 5 years. And when you enter the system, actually, there are more questions to be answered, as he said. So my patient, maybe it's under my name, so I will go there and I should identify what I am. I am a treating physician, I'm a consulting physician, I'm a reviewer, I'm a researcher, I'm an investigator. So you should go through that, and that will be automatically in the system. So any abnormal move, you will be contacted immediately.
Yeah. Same here. We switched to two-factor authentication recently only, but I have to say that the medical systems and the SaaS systems, they are, or the KISS systems, or the informatics systems of the hospitals, are not yet, at least in Germany, really well in authentication. We still are typing in passwords. I mean, this is really the past. And if the passwords are secure, you all know we have 11 digits, we have mixed passwords, we have small caps, large caps. It takes time, even if you have an easy one, you know. Yep. And if you then end up, when I want to enter the hospital from my secure laptop outside, when I'm on call, for example, look at the X-ray, I have to first go into the system of the computer with a password. I then have to go into the VPN. I then have to establish the virtual platform, and then I have to go into the official system. So I type in 4 times the password, you know. And then this two-factor authentication kicks in. So and then if I use my phone, I just look at my phone, and then I would see the X-rays, you know. This is the reason why a lot of our young guys always use WhatsApp, for example, which is crazy, of course, from a data protection or security. But if you have a patient that is critically injured, I mean, then you ask yourself, what is security, you know, and what is safety? Huh? And so these problems still have to be solved, and they are not yet solved. So again, I'm putting the circle to what I said in the beginning. And easing the processes, that's the most important thing. I think we need these protection layers, and they even have to be better because also the attackers get better. But we have to make them easier at a high security level. I think this would be the task.
Very, very good comments. I can comment from Finland perspective. So in government hospitals in Finland, we actually have also like a physical ID cards for all the doctors and nurses, and only way to access the system is to put a card to a card reader. So it's one additional layer, but on the other hand, I have understood at least that there's only one password to be typed after that, and you are logged into the system. That was the provider side. How about patients? How can they access their data in Germany?
In Germany, they have the right to demand all the data that has been collected on themselves. So, but they have to go to the radiology department and get it, or they have to go to the orthopedic department, trauma department, and get it. We have already an electronic patient card, but it's not yet on a Scandinavian level, I would say. Yeah, if I look at Denmark, for example, it's much better. I don't know how the situation in Finland is, but it's the dream of a doctor, of course, to have everything on one card, and also the dream of a lot of patients. If I consider the patients that come with 100 CDs that I then have to put into the system.
Is there, by the way, a national ID which how you could identify the same patient in hospital X and hospital Y?
We do have this, but it's not yet fully implemented in terms of functionality. So what I would wish for is I put in the card, have all the data. This is not yet there due to data protection laws, and we have not overcome yet. I don't know, how is it in your systems?
We have actually in Finland we have a banking ID which is tied to your social security number, and people actually use that bank ID to access all the health records and such, so you can basically access your data in every single hospital with the same user account, or not user account, it's your bank ID that you use, and you can fetch your data. And similarly, if someone from the government level would need to access to your data, they would use the same social security number, and they could get the data from multiple hospitals.
We are working in something similar to that, but still, you know, some patients, they don't want you to know all the data for them. So we are using the national ID nowadays. If we go maybe 10, 15 years ago, there are a lot of private hospitals when they treat the patient, they don't even take all the information. But for the last maybe 10 years, no, it is obligatory that they use the ID. For my hospital, actually, they can print all the information, all the documents from the application. So they have everything. Only those confidential reports, which we mentioned clearly, this is confidential, it will be locked, and they will not be able to see it. But they will be able to print all the documentation, even the progress note. If they want really a CD or copy from the images, no. They need to go to the radiology and take it, but they will be able to print the radiology report from the same application.
Can I ask one question? Can I ask you a question? I mean, if you said a certain governmental layer can have access, what if you don't have a very favorable government anymore in Finland? I mean, we're discussing this in Europe a lot, and it's not only governments, it's also insurers, for example, that might want to have this data. So how do you prevent that, for example, your personal data as a patient, now I'm asking you, is protected from non-medical approach?
Of course, you need audit logs, and we see that every now and then in the news that there are, for example, cases against doctors who have seen to watch the data of the patients to which they should access to. So it actually works. Of course, if you don't have a favorable government, everything can happen, and that's very unfortunate in the world where we do live.
This we can't solve.
Do you want to comment?
No, actually, basically, still, as I said, most of our data is still not integrated properly well, especially I'm talking from Japan's perspective. Right now, but they are trying to do something where they'll attach everything to something called My Number, even the insurance card and everything. But right now, because most of the hospitals are still offline, the access from hospital to hospital is still not 100% there. So usually you get a doctor's consent to actually approach another doctor, and then he sends all the information to the other doctor. I don't know how they share it, but usually through reports and things like that. But still, we see a lot of challenges in terms of integrating the data, especially in Japan. Government, like Ministry of Health and Labor Welfare, is pushing to have something like America, which has, FHIR HL7 standards to have everything, like there's a proper interoperability between the healthcare systems. But of course, there are a lot of challenges in actually protecting and implementing those standards across the country. That's what.
We have 5 minutes time, and we have actually one important topic that we haven't covered at all when it comes to data security, and which is actually cloud services. So how have you seen the approach towards cloud services? We have some cases. I've seen some cases in Germany, and in the past, Germany has been quite strict towards cloud services compared to, for example, in Finland. So what's the situation now, and how do you see the development in the future?
Actually, we are like 100% cloud-based company. We don't work anything offline nowadays, but I think we are trying to implement new architectures, especially, I was discussing about blockchain as one of the solutions, putting entirely where the data is encrypted, and then only the stakeholders will have access to the private key where they can access the data. And that's one of the things as a cloud-based company, we are trying to implement those architectures, especially with a lot of IoT devices, like IoT devices. The data coming on needs more security. But then the biggest challenge what we see is implementing these new technologies has a huge impact on the budgets of the products. So we still don't see that level of advanced technologies coming into the picture, mainly because of the ROI that built. But at the same time, we are still not compromising on the very basic features of the applications, like having multi-factor authentication, single sign-ons, and then zero trust features. So yeah, being a cloud company, we have a very strong checklist, even though the client wants some time to be more user-friendly, but we say that as a policy, we have to follow these as a standard operating procedure in developing something on a cloud.
Yeah, we cannot work without a cloud, actually. Maybe, as I said, the data is really increasing, so maybe what we are doing now, or they are thinking to do, to start deleting some of them, especially if they are really old. Still, when you implement a new application, you need to think about it and how to adapt it. In the same time, actually, the price is an issue. So I agree totally that we need innovation in the clouds and the storing system.
Yeah, actually, my clinics doesn't really allow cloud. So even if you have a recheck on radiologic images, which is fully normally cloud-based, with an AI system, it has to be on the campus, physically. Otherwise, they are very cautious with this. So as long as all the systems are not convinced about the super safety of cloud solutions that has been corrupted a lot of times now, then I think, at least in Germany, it will be really hard, which is a pity because all AI solutions are, of course, will be cloud-based.
Yes, and that's the development. I seen an interesting fact from the Germany. So I can say we are hosting in AWS with no plans to do anything in-house. So probably we have to wait a couple of years with Charité before we enter. But my experience in Germany is that one CIO told me that they are totally fine with IBM Cloud, but they cannot use AWS because it's US-based. And
yeah, no, it's also in the European Union. Yeah. If you look at data protection, you have to put in if you send it to insecure countries. Yeah. And the US is an insecure country.
It is, but
for
it's
Europe.
IBM and AWS, they are both, in the end, US companies, and same laws apply to them.
There's also HIPAA.
So sales guys have done their work well. 1 minute of time. What would be your last comments, or is there something you'd like to ask from your fellow panelists? Or
I think we know it's very well discussed. I think what I understand is obviously training needs to happen. More and more education needs to happen. That's what we believe in terms of cybersecurity. How we use the systems, how we protect, what are the kind of passwords, how we store the data. I think it needs to develop from an individual perspective rather than and then it has to come from as an organization.
I totally agree. We need to stick with whatever policy in each institution, because I'm really thinking that each institution, they are familiar with the attacks and they are familiar with the mistakes. And train yourself, educate yourself, and be aware of all the legal and security aspect. Speaking about not only patient, even the clinical trials, the research, it's really important for all the researchers to know the ethical part and whatever they need to do to secure their data.
Personalization of authentication, security and safety, but make it easy.
Make it easy.
Yes.
Thank you. Now, we would still have some time for questions if there are any.
7 seconds.
I think actually we have a couple of minutes after this 40 minutes, as far as I have it understood correctly.
Oh, perfect, thank you. I have a question to Professor Winkler especially. So you told us you're using WhatsApp as like the short message service to see documents. What do you think if there was an application available in Germany especially? How much time would Germany need to implement it in all hospitals or just even in Charité?
You mean hypothetically if this would exist?
I know there is a system that exists, but nobody's using it. So we are working on hundreds of sites all over Europe, and we know WhatsApp is the go-to tool to have a connection between nurses, patients, and doctors and patients.
I have to say 2 things. First, I never said that we're using WhatsApp. Second, I think this is the blueprint of easy communication that has to be reached. And it's easily adopted and easily implemented. So if there would be something like this that would be safe and you can have it on your phone and not on a second phone that you have to carry around with you, then it would be the perfect solution to my mind.
but it will take at least 10 years to adopt.
It's Germany.
Thank you.
It takes a bit, but then it's good.
My name is Niels. Oh, sorry. I'm a healthcare consultant in the Netherlands, so EU as well. And my biggest problem with the EU is that we have all these standards like GDPR, but even in the Netherlands, the AVG, which is on top of the GDPR. And it makes it really difficult for companies to become international and to share that knowledge that they've built up. For example, in Finland, to spread it out to the Netherlands. What is your guys' experience with that? Might be a big question.
It's a big question, and it's unfortunate reality, and we are not talking about like GDPR, as I mentioned before. It's all about regulation, although we are in EU, and in theory there should be one framework of regulations or data security needs. Each of the not each, but almost every country has their own regulations and rules on top of the EU regulations. So I would say that if, and this is very unfortunate, that if a company providing software, for example, to hospitals would like to enter to a new market into Europe, you cannot just go and say that, okay, we are live in EU, but you have to also invest time to comply with the local regulations and at least clarify that you comply with all the regulations. And of course, it's slowing down the commercialization of the software, it's slowing down the innovation in Europe, it's also slowing down the economic growth of the Europe.
Yeah, okay, thank you.
And I think that wraps up our panel discussion. Please give them all a round of applause.